Welcome to the Iron Prescription podcast with your hosts, Doctors Lynette and Stuart. We're both GPs and we're both personal trainers, though we do both jobs in very different ways. We chat about the best things you can do for your health and fitness, and along the way, help you to avoid wasting time on the things that really aren't. Thanks for listening. So my initial impressions with this topic are the opposite extreme to female hormones.
Right, okay, in what way?
In that it isn't a hot topic by any means. I actually struggle. So obviously I've got my clinical experience of
Yes.
this, which even at that, I was just thinking this morning, what's the ratio of men to women that I see? Now, I see a lot less male patients generally. As a female doctor, you're always going to be skewed more towards female patients. But probably for every 20 women that I have a hormone-related conversation with, I probably see one man. And I would say of those, it's me bringing it round to hormones rather than them knowing or having an idea or wanting to discuss it.
Sure.
So that's the clinical side. And then I thought, so what's going on in the social media space and the podcast space for me to kind of find out about?
Yeah.
Lacking. Now,
Really?
Well, in terms of me starting with the content that I normally like to listen to, I thought, well, I'll just start there. And it was really only Huberman's podcast that seems to have strayed into that territory.
Right.
And yet, oddly, I moan a lot that most of the podcasts I listen to are very male dominated, but it doesn't seem to be a hot topic from my view into the world.
Okay.
What about you?
So I think I find that really interesting because I think it's massive.
Is it?
Yeah.
It's not reaching me. It's not reaching me as a coach. It's not reaching me as a doctor.
Right. So I think, interestingly, you strayed upon it last week when we were talking about women, and you were saying, that the menopause has been around for forever, for millennia, and we're only really talking about it in the last couple of decades, definitely the last decade. If I took you forward another 10 years, you would see how male menopause has been commercialized, and it's coming from the other side of the pond, so as all things happen, America have gone there first, and it's huge in America with testosterone replacement therapy for men as a result of primary loss of testosterone. Okay, so just so we're aware of that, there are two reasons why you would lose testosterone. There is the primary reason of aging, and that starts around the age of 30, and you start losing significant amounts of testosterone, measurable amounts of testosterone each year, at a ratio of about 1%. But obviously, 1% as you stray into your 40s and 50s suddenly starts becoming significant numbers. And then there's secondary reasons. So something like testicular cancer or certain treatments such as prostate cancer treatment, hormone blocking therapies are secondary reasons of why you would lose your testosterone. So, sorry, I'm turning my phone to silent. So what we're talking about here is predominantly men that are aging and losing testosterone as a natural occurrence in the same way as women lose their hormones, apart from we talk about the menopause in women. And of course, the term menopause is one day in a life. It's not a thing. It's an actual
moment in time.
Yeah, it's a moment in time when your menses pause, your periods stop. And that doesn't happen with men. So they get this slope that just goes down like this. There is no sudden whoosh down as there is with women with the hormones. So it's a gradual decline and it's a natural decline. However, not all men get it. And there's various reasons for that. Testosterone is a naturally occurring hormone that occurs in different levels for different people. So you may start off with a relatively moderate amount of testosterone. You may start off with a huge amount of testosterone. And when we look at people like bodybuilders and athletes, you often talk about people being genetically gifted. And one of those hormones where you have a genetic gift is testosterone. If you've got large circulating volumes of testosterone in your body, you are going to be physically more powerful, physically easier to train, and physically have adaptation to your muscle bed in the increase of muscle performance when you start training. So if you start off high and you drift down, then you're never going to become subclinically level
Yeah.
because you're already high.
Mm.
But if you could start off relatively low and very easily get into a subtherapeutic level of testosterone. And this is where the commercialization happens, is where everyone, they say, right, you need to take a blood test and find out what your testosterone levels. However, the caveat to that is not all men that have low testosterone have symptoms of low testosterone. And not all men that take testosterone therapy as a result of having a clinically low testosterone level will benefit from taking testosterone. So it's a really grey area. It's not a black and white. It's definitely not black and white. And the other thing that's really interesting about testosterone that I'm going to say right at the start is if you take testosterone and you do nothing, very little is going to happen to you. So when people see a bodybuilder on the TV and I think I've mentioned this before, when people mock them and say, oh, they're just, they're just on the gear. It doesn't work like that. It doesn't matter how much gear you take. If you are not working out hard in the gym, you will not get the benefits. And when we're talking about this isn't abuse of testosterone that we're talking about here. This is therapeutic use of testosterone. And you won't get the reversals that you expect with testosterone unless you actually do something with it. So it's no good just taking testosterone and going, oh, I'm going to be great. You need to work with it because of the way testosterone is and what testosterone does for you. It's not like something like cocaine where it's an illicit drug that you get an immediate hit from and you get that immediate surge of whatever from it. You don't get that from testosterone. Testosterone is giving you a hormone that you need to work with to achieve your normal functioning.
So in my mind, this is separating into two separate categories. We've got, like we said last time, we've got people with symptoms that need to be explored and investigated and
Yeah,
potentially managed.
yeah,
I see those men every now and again. One will
yeah,
come in, often feeling a bit fatigued, a bit under the weather. There may be nothing more specific than that.
yeah,
And then on the flip side, you've got an emerging commercial industry that needs to create a problem so it can sell you the solution.
yeah,
And so making suggestions, might you be quite tired? Might you be underperforming? Might your libido not be what it was when you were 25? You start to create a market. As I say, these adverts, there was a time when Instagram obviously thought I was a man. And all of my ad feeds were very male hair replacement, men's suits. And I think I finally convinced it I'm female. But I have to say, I didn't see any marketing for anything along these lines. I know there is a company, and I can't remember it. Maybe it's a good thing that I can't remember the name, that is starting to promote this because a patient did mention it recently. And they've got ads on the underground. So like most things in the UK, it starts in London and then
yeah.
kind of, it bleeds out into the rest of the country. So I do
I know
think
that.
it's
Yeah,
beginning.
I know the name of the company. It's Newman.
Newman, that was it. I was going to say New, yes.
Yeah.
And I've had one person so far who happens to commute to London who
Okay.
came in and had some blood test done. And I've also seen some of the pushback from the evidence-based purists in the medical space who I respect, who are not very happy about this. But this is the way the world is going. So yeah, we are into the realms again of, are we managing symptoms and is this the most appropriate way to manage something? Because sometimes, and I have had these guys in clinic where we've done a set of bloods and at that 9 a.m. testosterone is just really low.
Yeah.
And putting them on a bit of replacement makes them feel human again. It's
Yeah.
wonderful to be able to provide that in the same way that when you correct somebody's underactive thyroid or very
Yeah.
overactive thyroid and they suddenly feel human again. But there's always other stuff, isn't there? There's always other things, as we alluded to last time, that have got to be taken into consideration.
Absolutely.
Number
I mean,
one being your size.
yes. Yeah. So I mean, I think so. First of all, I mean, it's we've got to understand what testosterone is. And now, testosterone was discovered in I think 1781. It was hailed as the elixir of life for men. So it is described in the early literature of the reason why men just don't feel male anymore,
Mm.
get older. And I have to say, there's lots of reasons why men don't feel male as they get older. And it's not just testosterone. There are lots of reasons why in your life, when you're working really hard, you have a family, you have all the financial commitments, life stops being about sport, your mates, etc., etc. And that can make a male feel, well, what actually is my role as a male? And they lose that direction of where they were before. That's not about testosterone. That's about a social psychological interaction
Mm.
with their surroundings within their life. All all good things, especially in medicine,
Mm.
have a bad side to them. And you need to understand that testosterone is one of those. And there are lots of reasons why taking testosterone can be bad for you. I'm going to point out a few here, and I'm also going to talk about the other one, the elephant in the room that people talk about and they don't really understand. So the first thing is that if you're taking testosterone, you are susceptible of getting high blood pressure. Now, high blood pressure is predominantly seen in men anyway. It's a risk factor for coronary artery disease and for vascular disease. And it's something that you should be aware of. If you're taking testosterone, you may develop high blood pressure. You also increase the chance of having a blood clot with testosterone, possibly because you increase the thickness of your blood, for want of a better word, your hematocrit can go up. So that needs measuring on a regular basis. And then the other big one that people talk about is that it causes prostate cancer. So just for the record, testosterone does not cause prostate cancer. Testosterone can elicit, or theoretically can elicit, the growth of a prostate tumor that's already in situ. So if you're not going to get prostate cancer any time in your life, taking testosterone will not give you prostate cancer.
Okay.
But if you do have a prostate cancer sitting there waiting to emerge, and sadly, 1 in 7 men, 1 in 8 men, 1 in 4 Afro-Caribbean men will develop prostate cancer. So if you're one of those men, you're likely to bring about your prostate cancer earlier in life. It's going to show itself a lot quicker than if you didn't have that. So for that reason, you have to have regular PSAs, prostate-specific antigen, annually to make sure there's nothing underlying.
But even that's not a free pass. None of us know what susceptibility we've got to malignancies. There is an element of Russian roulette with that. So you can't necessarily get as much reassurance as would be ideal by having a normal PSA as we
No,
can.
absolutely. You can have a PSA that's normal. For the record, I had a prostatectomy just over a year ago, and I had a prostatectomy to remove my prostate because I had prostate cancer, and I had a normal PSA. And it was only the fact that I am a absolute health hypochondriac, and I'd got a trend, and I love trends rather than actual figures, and I'd got a trend of an increasing PSA. And that was enough to say, okay, I'm going to have this further investigated with an MRI. But on my PSA at its highest was 2.26.
Wow.
And
You wouldn't really
the
raise an
range,
eyebrow at that if it landed in
wouldn't
my
even, yeah,
reduction box.
exactly,
Mm.
exactly. And so for the people that are listening, normal range is 0 to 3 or 0 to 3.5. So 2.26 is well within the limits of. But my lowest had been 1. And it was that trend and this is why PSA is not I don't want to sort of drift off this subject, but that's why PSA is not a very good indicator for prostate cancer. But going back to the testosterone, it does create a risk. But with everything in life, there is a risk. You're more likely to have, if you're susceptible and have an underlying berry aneurysm, deadlifting is going to show it. And probably, you're deadlifting 200 kilos, it's going to show it. Did it cause the berry aneurysm? No. Did
Mm.
it exacerbate it and make it cause a problem? Yes, but it was going to happen at some point, most likely.
Well, it's the same with cardiovascular disease. Nobody knows until they've had an angiogram whether
No,
they've got some emerging cardiovascular disease in their coronary arteries, and something you take or do might accelerate that process. Call the
absolutely.
plaque to Fissure, and and welcome
Boom.
to, welcome to heart attack land. But we all have to live with risk, and we can't tiptoe around being risk free. It's only what level of risk you're comfortable with. I think it'd be worth also just mentioning on the topic of that, younger people, but specifically younger men, tend to have much less capacity to care about risk.
Yeah.
There
Of
is,
course. Why would you care about risk when you're
yeah,
25? Because
yeah,
you're talking about a risk that's 25 years away.
yeah. So, men in their 20s are going to live forever. And if they're looking for optimal performance in the gym, in some other sport, you can see why the allure of something that's going to enhance your performance might be quite attractive. And
Yeah.
what's risk anyway? As I say, I can only think of a couple of people I've met in a clinical setting who've done that. One was an MMA fighter years and years ago, and interestingly, he'd used some testosterone, exogenous testosterone, stopped it early enough that he felt it wouldn't be detectable in his fight. He was going off to Thailand to fight in a competition, and came to see me several months later because he still had erectile dysfunction from it. And the end result was, after a little bit of testing, he still hadn't resumed producing testosterone naturally.
Yeah.
And he was really confused because he was adamant that what he had bought was short acting and this shouldn't have been an issue. But of course, you don't know what you're buying, in the gym. There isn't really
Yeah.
any guarantees with all of that. And so it took, I don't know how long it took to come back because I didn't see him again. He just needed the initial testing. So it's interesting that somebody in that, don't need to worry about risk demographic, was literally bitten in the arse by a problem that he hadn't anticipated further
Yeah.
down the line. He had a very unhappy girlfriend, I have to say,
Yeah.
and it was
So,
causing additional pressure.
yeah, so let's just, I mean, we should just really talk about that, why that happens. So when you take, so the way the body works in a lot of mechanisms is that you have a chemical that makes the hormone release, it makes it produce. And then that part of the body measures how much testosterone there is, and then it reduces the amount of go, go, go juice, if you like,
Mm.
then slow down. So if you give the body, for example, testosterone, then that part of the body goes, right, okay, we've got loads of testosterone. I don't need to do anything. In fact, to the point where it goes to sleep. And it goes to sleep so much that the gland that secretes testosterone, which is the testicles, reduce in size. In fact, they almost disappear.
Mm.
Um, to, and that doesn't mean to say you can't wake them up, but the more you've used testosterone, the larger the doses you've used, the harder it is to wake those glands up again. So what we talk about in testosterone therapy is not just stopping, which is what athletes do to
Mm.
avoid being caught. We slowly reduce it and we try and wake up the testicles as we slowly reduce it because the body goes, oh, I haven't quite got as much here and I need to wake up a little bit, as opposed to just boom. So and that is a risk. So, if you're on long-term testosterone therapy, you are probably on it for life
Mm.
because you're not going to wake up those testicles again to secrete testosterone in their own right. So that's something else to consider. But why take testosterone? So what does testosterone do to the body? From a medical perspective, the reason why we're giving it, we're not giving it for performance in the gym.
No, at least
We're
I'm
giving
not, and you're not.
it. We're giving it because it's a huge impact on male mood and basically the way you feel about life and the way you feel about yourself. So testosterone gives you confidence. It makes you feel more present in a room. It makes you not the shrinking violet in the corner. And that's something that men often talk about. I used to be able to give a presentation and feel confident about giving a presentation at work. And now I feel awful. I'm, shaking. I'm feeling very nervous. And I don't feel like I've got anything to offer. And that's a classic sort of low testosterone indicator. However, that is also an indicator of depression,
Mm.
which is also incredibly common in males in middle age.
Much more so. than low testosterone, or are we not testing for it?
Well,
Yeah.
yes. So this is the big argument. There's a lot of SSRIs. We talk about men not seeking help with their mental health, but is it that men aren't seeking help with their testosterone levels? And I'm a big advocate of this and looking at this, and I'm not saying that every man who's depressed will have low testosterone levels. Definitely not. But I'm saying that before I diagnose somebody with depression, I like to do and you're probably going to raise your eyebrows at this and say, what are you doing, Stu? But I like to look at their biomarkers across their bloods, because there are lots of things that can mimic depression. And I just want to make sure we're not missing anything. So testosterone does mimic depression, and depression mimics
Would
low testosterone.
so would you still do that if somebody gave a very typical history of, life just becoming very stressful, and the typical middle-aged man, let's say he's overreaching at work, he's not keeping up, and I'm just thinking, recently I've had a spate of signing off a lot of teachers, for example, and the education system's tough to work in.
Yeah, yeah.
I wouldn't necessarily, well, I wouldn't do any bloods, particularly if somebody gave me a very convincing history of being overwhelmed with work and needing a break, and tipping over into depression, unless time was ticking on and they weren't picking up with space from work, the exercise prescription, all those other things. It would factor much later in my thinking than it would initially.
So it's interesting. So I'm the reverse. So if unless I've got somebody that's got a boom marker of a reactive depression, so I got the sack, something like that, a moment in time, I've had a divorce, etc., and things started going wrong there, then that's when I think about depression. If it's a slow decline into this state, I'm much more convinced to think
Okay.
that slow drift in is, to me, is an indicator of let's just check everything. And remember when we talked last week, if you give a woman who's got symptoms of the menopause, if you give her an SSRI, she's going to get better from a mood perspective. So same with a man. If you give a man an SSRI, you are going to make them there is evidence that you will make them somewhat better, but you're not treating everything. For me, I'm looking for rather than, well, it will work, but it's not. I'm looking for just to make sure because the testosterone will work for everything that they're missing. So first of all, it increases your mood. It makes you feel better. It makes you sleep better, and that's always going to have a knock-on effect to basically life. We are animals that need sleep. We do terribly with. I mean, it is a the deprivation of sleep is a form of torture to deprive somebody of sleep. So, if you're not sleeping well, that's going to have an impact. Thought clarity. So, having that sharpness of mind, again, is linked to testosterone, and that ability to be in a debate and to be able to function at that, which is, what men find themselves, whether that be they're talking about football or whether that be what they're doing at work. And remind me to talk about women and testosterone because it works. We talked about this last week, but it's exactly the same for women on that sharpness of clarity of mind. There's loads of memes about getting out of bed when you're 45, 50, and you're like, and everything hurts. Well, actually, testosterone does a lot to take that away. And as I said to you last week when we spoke about women, I've had a lot of good results for women who've got joint pain, and it's exactly the same with men. So it's not an analgesic. It seems to
Oils.
oil the joints and oil the physical function. And that's partly why the reason why you use it in the gym. So as a hormone of abuse for bodybuilders, it allows you to train harder and it allows you to train longer and it allows you to go back to training quicker. So if you're cycling on a muscle building strategy or a strength building strategy, the and we can talk about this in another episode about how do you get hypertrophy and how do you get increasing in strength. And sadly, it's not the first two sets; it's the third set, and it's not the first four or six reps is the last two that make the huge difference. That's where the gains are made, in the last two reps, when you've got the body to the point of having to adapt to get growth and strength. And I'm not talking about from a fitness perspective, because every rep works for that. From a strength, normal strength perspective, and a normal feeling fit perspective, every rep counts towards that. But if you're looking for true hypertrophy of a muscle, or true huge strength gains, it's the last bit that counts.
But it's probably worth saying that for most people, there is still enough leverage to be gained from normal training zones in a consistent
Oh,
program.
absolutely. Like, yeah. So,
But the
yeah.
people that are drawn to this are the people who've been in this space for quite some time. And I'm specifically thinking about gym populations rather than other sports.
Yeah.
And they need that extra push. They're reaching, usually because they're competitors or they're trying to achieve a certain look. And you
Yeah.
can see that this is where you can pull on a lever that naturally just, it's going to be years to get those same results. But for
Yeah.
majority of recreational people, sports people, you don't need to be thinking that this is some, elixir, so to speak, because you haven't
Mm.
done the basics for long enough, consistently enough to even begin to maximize your potential, I would say.
Yeah, although there's interesting studies about, it depends on what gym you go to, but we live in a world now where we live in an Instagram world, and if you go to a gym that's predominantly young people, the percentage of illicit drug use is scary,
Mm.
really scary, and they're just doing it because they don't want to be there for years, they don't want to train, they're not training to achieve a feeling, they're training to achieve a look, as you
Mm.
alluded. But anyway, but what testosterone does, it allows you to go through that pain barrier. It gives you that punch to be able to do those last two sets at failure. And from a endurance perspective, it gives you more endurance for those same reasons. So Lance Armstrong is a
Mm.
classic, or was a classic user of testosterone. So it allows you to go further, harder, and faster. And that's where either in competition you're going to win, or in training you're going to achieve the the level that allows you to outperform the person that's beside you. You're still having to perform. So going back to that, if you take testosterone and you do nothing, you will not see significant amounts of, especially from a clinical perspective, you won't see significant amount of growth and increase. The other thing that testosterone does do, though, makes you more sensitive to insulin, and therefore it decreases fat by making you utilize it as an energy source, because you're more sensitive to insulin. So it's easier to break down
Mm.
and use it as an energy system. You still have to do something to get into that deficit to be able to utilize it. It's not what I'm trying to say here, this is not a wonder drug. There is no wonder drug apart from Wegovy and Ozempic.
Mm. Yeah.
Because we'll talk about that
Yeah.
another day. But there isn't something that you're going to put onto your body and it's going to make you
Mm.
look like Arnold or like Chris Hemsworth or whatever.
Yeah, unless it will feel like a wonder drug if you're a normal guy who's been slowly getting more and more depleted to the point that
Yes.
you're hardly, then again, a bit like the woman who has the amazing response to HRT and says, wow, this is just incredible.
Yeah.
But
Yeah.
the next woman in the queue could have a very mediocre, nah,
But
whatever.
that's not a response physically. That's a mental response,
Mm.
and a psychological response. So yes, you're right. You can get that with definitely with testosterone, and that feeling of all those things psychologically and from a mental wellness perspective. But you're not going to also suddenly stack on a load of muscle.
Mm.
It will allow you. There is definitely a difference in your ability to train taking testosterone to not taking testosterone, for sure. And you may notice that in the gym, but you still are going to have to work with that to get that. And when I see clients that I've got that are on testosterone, wow. So just On that, you alluded to it with saying you take it to your testosterone at 9 o'clock in the morning. So the test is taken in the morning because that's when your normal highest occurring level will be, is early in the morning, and then it fades through the day, and that's a normal rhythm of your body. There's different ways of taking testosterone as well. We could just talk quickly about those. So you can take it orally. It's not very good orally. The absorption's not great. And also because it has to go via the liver to get broken down, it's quite liver toxic. So taking it orally is not really to be recommended. You can do it, but it's not great, and I wouldn't recommend it. You can take a short-acting injection intramuscularly, and this is the sort of drug that bodybuilders take it because they cycle. And when we talk about cycling, what they talk about is being on a therapeutic, or we can debate the word therapeutic, but they're on a regime where they're taking it every day for so many days, and then they will come off it, and then they will train through that period, and then they will go on it, and they're cycling the drug. And they're doing that so they don't get the toxicity of the drug per se, because they're not taking it all the time. And then there's a long-acting injection where you can take it intramuscularly that lasts 8 to 12 weeks. It's quite a thick oil. It's uncomfortable to have, but you don't have to worry about it. Once it's in, it's in. The problem with that is you get a huge dose of it, and then it dissipates down. But that huge dose can take you above therapeutic levels, and then it wanes down over the 8 to 12 weeks. Painful, you get a waning, you're not a constant level, and it lasts. But the benefits are you don't have to think about it for 8 to 12 weeks. The next one is a gel application. So gel applications are very popular, and so that's skin application. You put it on in the morning. You don't rub it in. You just put it on your skin, and it's absorbed through your skin. It's mixed with an alcohol gel, and you just let the alcohol gel evaporate, and that mimics the body. So you put it on in the morning, you get a high in the morning, and it fades through the day. So point to note, if people are listening to this and they're on testosterone therapy, if you want to know your levels of testosterone, okay, when you're doing your levels of testosterone, you must apply it in the morning and then take your bloods an hour to 2 hours after the application. Because if you don't put your gel on and you take your bloods, you'll get a false reading because you're relying on the day before. So if you get this normal 24-hour rhythm then with putting it on. And I've got clients that I can tell when they haven't put their testosterone on in the gym because their performance is different. Their lifting is markedly different from when they have taken it because they've got that
And are these
drop.
people you're working with? Because what I find when I've seen patients who are using any performance enhancing drugs is that generally they're quite open and upfront about it. And I'm not the police. I'm not here to question where it's come from. You need
No.
to know. Are
Yeah.
helpful. So, are the people that you're referring to people who are using it as a performance enhancing drug, or using it in a clinical setting, or is it a bit of both?
So the people that are using the gel are clinical. The people that are injecting are not clinical. I have a very, strict policy. I'm training you as a trainer. I'm not here as your doctor.
Yeah, I agree. Yeah.
What I always do, regardless, is I make sure that I've told both sides of the story. Because the people that are using it from a legal perspective, and let's be honest, it is illegal if you're buying it off the black market. First of all, I want to know what they're taking, and I do give an opinion on whether or not that is for humans. A lot of drugs that are used for veterinary medicine
Yeah.
that are in the dark web and the illicit gym use drugs, and so I do tell them whether or not it is the medication they think they're taking, and also I tell them the downsides to what they're using. I think I've got a duty to do that, doctor. But I don't say, if they say, "Oh, do you think I should take some more, or do you think I should take some less?" I go and see a GP
Yeah.
or urologist, because I'm not here to prescribe to you or give you that clinical information. I can tell you that is for human use. I can tell you you're taking too much, and I can tell you that these are the risks. But I don't tell them. I'm not the police. I'm not there to tell them to stop. And it also, I wouldn't want to. I'd much rather work with my clients being open and honest with me and telling me what they're using, rather than me not knowing and either that that causing a problem for them from a health perspective where I didn't know it was going to happen, or a breakdown in the relationship between us.
Yeah, I agree. I completely agree. And I think the boundaries between the two roles, generally, I've not found to be a problem. But I think, like you, making sure that somebody remains open about what they're taking or smoking or whatever is
Yeah,
essential if you're going to be coaching them through, a period of training. So,
yeah,
but people are adults, and I think, and I work like this in clinical practice. My role is to help you understand the risks and benefits on both sides and come to
yeah,
a decision by
yeah,
yourself,
yeah,
whether that's a legitimate HRT. It's not, I don't boss people around, tell them how to live their lives. It's helping them to understand, because sometimes people do get confused and can listen
yeah,
to somebody in the gym or on an Instagram reel talk about only one side of a drug, whether it's a hormone or whatever. And they need that, it needs to be balanced out to make an informed choice. So
absolutely.
um,
And yeah, I mean, and also it's worth saying, that from a illicit point of view, testosterone is one of the, we've talked about there's no drug is safe. It is one of the safer drugs compared to other stuff that is being used in gyms, which is, sometimes some of the stuff is incredibly scary, and you're in a very narrow therapeutic window of what you want to achieve, and very easily outside that window where you're causing catastrophic damage to your body. And the person that you're buying it off, although they call themselves an expert, they're not really an expert. What I would say,
gym steroid users are all experts. Trust me,
yeah,
you cannot reason with
I know
them.
they are. What I would say is, I'd always say, if you're considering doing any drug, first of all, make sure you have got your baseline bloods done. And you really want to be covering all your bases of your electrolytes, your liver function, your full blood count, so that you know whether or not you're going to have a problem. I'd also recommend an ECG and an ECG, because all of these drugs can lead to cardiovascular problems. And then when you start doing these drugs, be very, very cautious of where you source them from, and ask. There are lots of open medical places that can give you advice on whether that's a veterinary drug or whether that's a human drug. If you're going to inject, make sure you practice good needle safety from that perspective. And ensure that you are getting, when you start, at least bloods every. Initially, I would do, from when I'd started, I'd recommend bloods within a month, and then every 3 months thereafter, to ensure you're not missing something. And be open and honest with your doctor in telling them what's happening, and why suddenly you're sitting in front of them with an abnormal blood, because they have got to work with you and they've got to know what's going on. They're not going to report you to the police. But as you said earlier, I would strongly encourage people that are not using it for a clinical perspective to let me see what I can do without drugs. Let me see what I can do with purely a PT regime. And I think, most people are often blown away with what a PT regime can do for them. And another thing that I would say about the taking drugs and in performance enhancing, it's totally irrelevant if you don't go to the gym. I've already said that. But if you don't get your diet right, if your diet's not on point, you can take all the testosterone you like, but if your body doesn't have the protein to be able to do something with it, pointless. So first of all, I'd say to a client, let's talk about drugs later, unless they come to me on drugs. Concentrate on getting your technique right and your regime right in the gym, and let's make sure your body has the building blocks to perform before we start worrying about artificial substances.
I think that segues into a whole other area, which maybe we should come back to, because of the downstream consequences of fatty liver, what it does to your hormone profile. And probably we should cover that separately, because there's one small section of testosterone which we haven't touched upon. And we did briefly mention about its use in women. And you
Yeah.
said yourself, you've seen a great response. There is very much a nervousness still in the clinical side about managing women who are on testosterone. I see this. So a typical scenario would be a woman who's been started on testosterone, and like most things, we go in at a dose which we know will work for most people, and then you need to measure it and titrate up or down. And occasionally, a woman will come back with a reading that's particularly high, and then there's a little bit of panic about it from a clinician who's not used to managing this, which doesn't necessarily strike me as needing to be a problem. You can just pull back and let it fall naturally. Yet, we have an emerging field of medicine in transgender healthcare where we have got women wanting to live as men with huge doses of testosterone, and as far as I'm aware, not routinely being put into clinical trials to look at the consequences of a biological woman taking high levels of testosterone and what happens years down the line. So it'd be interesting to see, and maybe in 5 years' time, there might be some clear data on this.
Yeah, yeah.
Because these people are typically young.
Yeah.
But nobody seems to be panicking about this in terms of effect on cardiovascular health or elevated risk of thromboembolism of clots.
Yeah.
So it's interesting, and I constantly come back to this as a slight disconnect between the panic we've got in denying women testosterone where they could really benefit from it and feel a lot better, and yet we swing the other way on the advice of specialized clinicians and put biological women on huge doses. And to my mind, it seems to be okay, but they are generally a younger population. Well, no, they're not actually. There is a lot
No, no.
of
And
Asian
it's,
old transgender patients now taking big doses of testosterone. Interesting.
yeah, we should probably do a topic on this, and we could probably cover it with the nutrition one as well. But alcohol is far more damaging from a physical perspective, from a mental health perspective, from a performance perspective, than any of the drugs that we've talked
Mm,
about
mm,
this morning. So it is incredibly interesting. But yeah, so bottom line is I'm definitely not against testosterone. I'm willing to look at it. I recognize that there are definitely lots of mimickers of low testosterone, but I also recognize I think we're missing a lot of low testosterone in guys. But that doesn't mean to say that it's going to work.
mm.
And we've got to be very careful of giving out stuff just because we can, and not really understanding why we're giving it out.
I agree. I think probably, as we said at the start, this will grow in demand, and people who are more plugged in online, I think, will probably be the ones that start to trickle in and ask up front to have their testosterone measured, which is, gathering data is no problem.
It's what you do with it.
Yeah, yeah.
I think as well, I mean, I have to say, there'll be a lot of people out there listening to this who will go, oh, but I asked my doctor for a testosterone level and they wouldn't do it.
Mm,
I think there is definitely a cadre in the medical field, particularly in general practice, that aren't really catching up with testosterone, particularly in females, sadly. And that as soon as a man says they want their testosterone measuring, they think, oh, it's because
mm,
he wants to, use the juice and get all
mm,
hench and stuff like that, as opposed to understanding. So
mm,
I think it's about educating. Sometimes doctors do need to be educated. They're not trying to do it on purpose to be
mm.
anyway. They just sometimes you have to remember that as a patient, you need to justify your position to the doctor to help them understand what you really want. It's not we're trying to be difficult. We're just trying to do the best thing for you.
Yeah, yeah, I completely agree. Okay, good. I think that's a good point
Brilliant.
to leave it on. And
Yes, sure.
cool. We'll come back with the next topic next week.
Look forward to it.